Coronation Street actress Cherylee Houston, who has played the role of Izzy Armstrong in the ITV soap since 2010, has been battling with Ehlers-Danlos syndrome since the age of 23. The 43-year-old has been in a wheelchair ever since she was diagnosed with a rare condition, which affects connective tissue, and often leaves her unable to move because of the illness. Although she has insisted her acting career eases her pain. Speaking on BBC Radio 4 show titled The Agony and the Ecstasy, Cherylee said, "I am continually in pain. There's something about acting that enables me to break through my pain levels. There are a couple of times a week, at least, I get stuck where I can't physically move, get out of bed, get dressed, do anything for myself. My voice goes. But what is Ehlers-Danlos syndrome? Here is everything you need to know about the rare inherited disorder according to the NHS website. According to the NHS website, Ehlers-Danlos syndrome, which is also known as EDS, is a collective group of rare inherited conditions, which affect connective tissue in the sufferer's body found in the skin, tendons, ligaments, blood vessels, as well as other internal organs and bones. EDS is a hereditary condition, but certain types of EDS can be passed on from one parent or both carrying the gene. However, EDS is not always inherited and can be found in a person for the first time. The rare condition in a relatively mild form can be disabling, but stronger and more severe types of the illness can potentially be life-threatening. According to NHS website, there are various signs of EDS. The health site has stated joint hypermobility and an increased range of joint movement can be a symptom of the condition, while stretchy skin or fragile skin, which bruises or wounds easily, are other signs of the condition. The various types of EDS have different symptoms. Hypermobile EDS is characterized with loose or unstable joints, joint pains or clicking limbs, extreme tiredness, digestive issues, problems with bladder control and internal organs. Classical EDS often shows visible signs of damage on the surface of the skin, while vascular and kyphoscoliotic EDS are rarer forms of the condition, with the latter characterized by a curve in the spine. However, the NHS site has stated people who notice a few of the symptoms, which do not cause any problems, do not usually need to worry, as joint hypermobility is a common ailment and is unlikely to be a symptom by EDS. EDS is most often inherited by a parent or both parents, who are carriers of the EDS gene. If EDS is inherited, members of the family with the condition may have different forms of the disorder. According to the NHS, there are two main ways EDS is inherited: autosomal dominant inheritance, which is when the faulty gene that causes EDS is passed on by one parent and there's a 50% risk of each of their children developing the condition, and autosomal recessive inheritance, kyphoscoliotic EDS, when the faulty gene is inherited from both parents. However, in some cases the sufferer may be the first person in the family to have the condition. According to the health site, there is no set cure for the rare condition. However, there is a vast amount of medical support on hand for sufferers of the disorder, including discussing the symptoms with a GP who can refer the patient to a local genetic service to assess the condition, as well as visiting a rheumatologist. A specialist EDS diagnostic service is also available for patients, which will involve the medical expert assessing the patient's medical history, as well as their family history, before carrying out a blood test to provide an accurate diagnosis. If a patient has EDS, adapting activities can help the patient live comfortably with the disorder. Low-risk exercises, such as swimming, are advised to continue, whereas strength training or heavy lifting is meant to be avoided by EDS patients. A person battling with EDS can also see a physiotherapist to learn specific exercises to ease the pain and strengthen joints, as well as an occupational therapist. Counseling. including cognitive behavioral therapy and genetic counseling, is also available to EDS patients.